Hillanter defines community as a thing which consists of people living together in some form of social organization and cohesion. Its members share in varying degrees political, economic, social and cultural characteristics as well as interests and aspirations, including health. Communities vary widely in size and socio-economic profile, ranging from clusters of isolated homesteads to more organized villages, towns and city districts. According to CBR working group, community means a group of people with common interest who interact with each other on a regular basis and or a geographical, social or government administrative unit. CAHD defines, according to Douglas Crafting, author of Understanding Community Approaches to Handicap in Development, community means people, their families and the organizations that influence their daily lives. Explanation of the term community. Generally, communities are not in every case homogeneous or static entities. A traditional rural community may not have all its members coming from the same ethnic group, speaking the same language or sharing the same culture and religion. Only some of these conditions may be present in many rural or marginal urban settlements, and as a consequence, a community spirit might not be so easy to identify. In such a scenario, it may take longer to get a community response to the call for an effort to show solidarity with persons with disabilities. In general terms, a community is a subset of society, but it is larger than a family. It constitutes a group of people living together in social association, harmony and understanding. The existence, involvement, cooperation, interest and participation of the members of community influences survival, progress, development and welfare of the individuals directly or indirectly. This group of individuals generally has a common goal, common causes and develops a sense of belonging. They share their views on their political, cultural, economical and social ideology with each other. A community usually comprises of family members, neighbors, friends, co-workers, reference groups or opinion leaders, local administrative authorities, local transport authorities, postman, school teacher, village headman, local revenue officials, nearby shopkeeper, local development agencies, local welfare agencies and other people or officials. Explanation of the term within community. In the ILO, UNESCO, WHO approach to community-based rehabilitation, the phrase within community development is understood to be the following strategy recommended by United Nations. The concept within community refers to the stimulation of local initiative which may be supported with outside support, advice and specialized inputs for ensuring community empowerment. The approach ensures that what is done at the initiative of community in the name of community-based rehabilitation actually fits into the reality of community and is solely owned by the community itself. O'Toole goes a step further and advocates that community involvement in rehabilitation is a process which needs to be nurtured and facilitated. It is not simply rehabilitation done at the community level, but rather rehabilitation as a part of the process of community development whereby the community seeks to improve itself, and that is the beginning of community-based rehabilitation in the true sense. The term based connotes that rehabilitation and integration of the disadvantaged individuals is a responsibility of the family and the community. It is necessary for the community to realize that all human beings are of equal worth and are entitled to equal rights, privileges and responsibilities. We need to stress that it's the responsibility of the community to create appropriate opportunities for the complete rehabilitation and acceptance of the disadvantaged into the mainstream of society. The responsibility of caring for disabled persons is ultimately that of his family and community. Whatever services provided by a specialist or an external agency are by and large need-based interventions and cannot be expected to be permanent in nature. Ensuring the active participation and support of the community in promotion of comprehensive rehabilitation of its members is imperative foundation of community-based rehabilitation. Community-based rehabilitation is founded on the principles of equity, equality, equal rights and social justice. It implies that the disadvantaged groups in a community have the inherent right of availing services and opportunities at par with other individuals. For them, the community is like a backbone, a support system which ensures their well-being, survival, growth, progress and complete integration. Community is like the roots of a fruit tree which encourages their active and meaningful participation in all spheres of social life. It is a bridge which connects a disadvantaged individual to a productive social life. Community-based rehabilitation implies that persons with disabilities are entitled to at least all such privileges which they would have been entitled to had may not been disabled. Importance of community. Most human impairments are caused primarily by environmental factors such as disease, lack of healthcare facilities, lack of public awareness, superstitions, wrong treatment, lack of early screening and health checkup services. Thus, most of the disabilities are acquired and are not necessarily due to the fault of the individual. The family is the right place and community is the perfect base for creating a rightful place for the disabled and enhancing their acceptance as equal individuals in society. The family is the first social unit a disabled individual encounters, and it is necessary that this unit should accept the disabled totally and plan for his holistic development. Attitude of community. The Community-Based Rehabilitation Development and Training Center CBRDTC in its approach uses professionals, volunteers and existing institutions in the community to take up a community development program to integrate people with disabilities into the mainstream. The CBRDTC's approach is based on the understanding that the problems faced by people with disabilities in their daily lives are the result of not only their individual impairment but also of the attitude and beliefs of the community in which they live. Rehabilitation, a continuous process. A community-based rehabilitation program initiates the process and provides individual need-based services with the active participation, involvement and understanding of the community. The prime responsibility of the community-based rehabilitation program is to provide the technical expertise and training in the skills of rehabilitation to persons with disabilities, the family and the community at large. Outcome of community-based rehabilitation program. If the community participates in program planning and its implementation, the community-based rehabilitation approach would be sustainable and would ensure delivery of services forever. It would also ensure involvement, understanding and participation of the community on a permanent basis. It would promote sense of belonging among the individuals and reduce their dependence on outside inputs and services. It would bring about self-reliance and complete rehabilitation of the individual. Community has plenty of resources, the desire to support and the potential to promote appropriate rehabilitation. What it lacks is appropriate information, skills, technology and support system which have to be organized by the community-based rehabilitation program as inputs and service delivery mechanisms. The traditional definition of community-based rehabilitation. Community-based rehabilitation is the goal-oriented, individual need-based, cost-effective and result-oriented strategy of providing time-bound and appropriate services within the community with its active participation, involvement and with fullest use of its resources. Community-based rehabilitation strategy aims at confidence building of the community, bringing out efficiency of individual and promoting active participation, involvement and integration of the individual in community life. It seeks community participation at the planning, execution, management and monitoring of community-based rehabilitation program. It ensures community support to protection of human rights, equal participation, equity, social justice, equal participation and complete development of the individual. What's the status of community-based rehabilitation? Though community-based rehabilitation is practiced in more than 90 countries, it's part of many national strategies. Most community-based rehabilitation programs follow a vertical approach, which mostly focuses on a single sector or domain, for example, health, and often with an exclusive focus on physical rehabilitation, or education with an exclusive focus on pre-primary and primary school inclusion, or livelihood with an exclusive focus on income generation activities. People's needs are multidimensional and human development requires well-being in different domains including health, education, livelihood and the social as well as physical environment. To ensure people with disabilities to have and to lead full and fulfilling lives with dignity, community-based rehabilitation needs to adopt a multi-sectoral comprehensive approach addressing the key domains of well-being. The CBR Joint Position Paper recognizes that people with disabilities should have access to all services which are available to people in the community such as community health services, child health, social welfare and education programs. It also emphasizes human rights and calls for action against poverty and for government support and development of national policies, all leading to inclusion of persons with disabilities in the mainstream of social life. CBR was initiated by the World Health Organization following the declaration of Alma-Ata in 1978. It was promoted as a strategy to improve access to rehabilitation services for people with disabilities in low-income and middle-income countries by making optimum use of local resources. Over the past 31 years, through collaboration with other UN organizations, non-governmental organizations and disabled people's organizations, community-based rehabilitation has evolved into a multi-sectoral strategy to address the broader needs of people with disabilities, ensuring their participation and inclusion in society and enhancing their quality of life. Purpose of CBR guidelines. The purpose of these guidelines is to provide support on how to initiate a CBR program or how to strengthen an existing CBR program. The target group for the guidelines is CBR managers as well as personnel from local and international non-governmental organizations, government ministries, development organizations, primary healthcare programs, education programs and organizations of people with disabilities. They are designed as a practical guide to strengthen the delivery of community-based rehabilitation and promote inclusive development as a life cycle approach. CBR matrix. According to these guidelines, a comprehensive multi-sectoral CBR program should cover the key domains of well-being like health, education, livelihood, social and the empowerment of people with disabilities and their families. In the light of the evolution of CBR into a broader multi-sectoral development strategy, a matrix was developed in 2004 to provide a common framework for CBR programs. The matrix consists of 5 key components: the health, education, livelihood, social and empowerment components. Within each component, there are 5 elements. The first 4 components relate to key development sectors, reflecting the multi-sectoral focus of CBR. The final component relates to the empowerment of people with disabilities, their families and communities, which is fundamental for ensuring access to each development sector and improving the quality of life, enjoyment of human rights for people with disabilities and their inclusion in the mainstream of social life. CBR programs are not expected to implement every component and element of CBR matrix. Instead, the matrix has been designed to allow programs to select options which best meet their local needs, priorities and resources. In addition to implementing specific activities for people with disabilities, CBR programs will need to develop partnerships and alliances with other sectors not covered by CBR programs to ensure that people with disabilities and their family members are able to access the benefits of these sectors and attain appropriate inclusion. Health component. The right to health without discrimination is captured in various international instruments. The Constitution of the World Health Organization states that enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion and political belief, economic or social condition throughout the life of an individual. CBR programs support persons with disabilities in attaining the highest possible level of health, working across 5 key areas: health promotion, prevention, medical care, rehabilitation and assistive devices. CBR facilitates the inclusive health by working with the health sector to ensure access for all people with disabilities, advocating for the health services during the lifespan of individual to accommodate the rights of people with disabilities and be responsive, community-based and participatory. Coming to education component, the role of CBR is to work with the education sector to help make education inclusive at all levels and to facilitate access to education and lifelong learning for people with disabilities. The desirable outcomes are all persons with disabilities have access to learning and resources that meet their needs and respect their rights. Local schools take in all children, including children with disabilities, so that they can learn and play alongside their peers. Local schools are accessible and welcoming. They have a flexible curriculum, teachers who are trained and supported, good links with families and the community, and adequate water and sanitation facilities. People with disabilities are involved in education as role models, decision makers and contributors. Home environments encourage and support learning. Communities are aware that people with disabilities can learn and provide support and encouragement for lifelong learning. There is good collaboration between the health, education, social and other sectors. There is systematic advocacy at all levels to make national policies comprehensive to facilitate inclusive education. Now we will see the livelihood component. It is a part of CBR because it is essential to ensure that both youth and adults with disabilities have access to training and work opportunities at community level. The learning of knowledge and skills begins in the family at an early stage, as children watch and learn how to do things from parents and other family members. Children with disabilities should also be encouraged to learn, participate and make a contribution in the family. Likewise, disabled family members of working age should be assisted and encouraged to develop skills and start or return to work. A CBR program that does not address the skills development and livelihood needs of youth, adults and senior citizens with disabilities in a community is incomplete and limits the sustainability of other efforts. Social component. The role of the community-based rehabilitation is to work with all relevant stakeholders to ensure the full participation of people with disabilities in the social life of their families and communities. CBR programs can provide support and assistance to people with disabilities to enable them to access social opportunities and can challenge stigma and discrimination to bring about positive social change. The desirable outcomes are persons with disabilities are valued as members of the families and have a variety of lifelong social roles and responsibilities. Persons with disability and their families are encouraged and supported to contribute their skills and resources to the development of their communities. Communities recognize that people with disability are valued members and can make positive lifelong contributions to the community. Barriers that exclude people with disabilities and their families from participating in social roles and activities are challenged and addressed. Local government authorities respond to the needs of people with disabilities and their family members and provide effective social support and services where required. Empowerment component. Empowerment is the final component of the community-based rehabilitation matrix and is a cross-cutting theme. While the first four components of the matrix relate to key development sectors, the empowerment component focuses on the importance of empowering people with disabilities, their family members and communities to facilitate the mainstreaming of disability across each sector and to ensure that everybody is able to access their rights and entitlements. The word empowerment has different meaning in different contexts and is not easily translated into all languages. Simple descriptions of empowerment include having a say and being listened to, self-power, own decision making, having control or gaining further control, being free, independent, being capable of fighting for one's rights, and being recognized and respected as equal citizens and human beings with a contribution to make. Focus of CBR programs. These programs have focused on the medical model, that is on the provision of rehabilitation to people with disabilities without asking for anything in return. While this has resulted in positive changes for many people with disabilities, it has also promoted a dependency model, that's a mindset of giver and receiver. Empowerment begins to happen when individuals or group of people recognize that they can change the situation and begin to do so through a life cycle approach. It's a process that involves things like awareness and capacity building, leading to greater participation, to greater decision-making power and control, and to act for change. The CBR guidelines provide a way forward for CBR programs to demonstrate that community-based rehabilitation is a practical strategy for the implementation of the Convention on the Rights of Persons with Disability and to support community-based lifelong inclusive development. Community-based rehabilitation is a multi-sectoral bottom-up strategy which can ensure that the Convention makes a difference at the community level. While the Convention provides the philosophy and policy, CBR is a practical strategy for implementation. CBR activities are designed to meet the basic needs of persons with disability, reduce poverty, and enable access to health, education, livelihood, and social opportunities. All these activities fulfill the aims of the Convention. CBR programs provide a link between people with disabilities and development initiatives. The CBR guidelines target the key sectors of development that need to become inclusive so that people with disabilities and their family become empowered, contributing to an inclusive society or society for all. As community involvement is an essential element of development, the guidelines strongly emphasize the need for CBR programs to move towards involvement of community at all stages of life cycle of an individual.